All right, let's dive into the amazing science of pharmacology. We're going to figure out how the medicines that pretty much shape our modern lives actually do what they do. You know, for most of human history, getting sick was a total mystery. We were completely in the dark, basically fighting an invisible enemy with no real clue what was happening inside our own bodies.
But wow, fast forward to today and that picture has completely flipped. Thanks to incredible leaps in chemistry, biology, and biochemistry, we can now hunt down the exact causes of disease right down to the molecular level.
And this really gets to the heart of modern medicine. We've gone from just guessing to having this incredible precision, targeting problems right at their source.
This quote just nails it. It doesn't matter if it's a virus, a bacteria, or some kind of genetic issue. The problem always begins with molecules. And, well, that means the solution has to work at that level too.
So, how do we wage these molecular battles? We use a really powerful tool, the drug. But what does that word even mean in a scientific sense? It's probably broader than you think.
Okay, so here's the official definition. See, a drug isn't just something your doctor prescribes. It's basically any chemical substance that causes a change in how your body functions when you take it. And that definition covers a huge range of things. We're talking about everything from the penicillin that knocks out an infection to the insulin someone with diabetes needs. And, yep, even the caffeine in your morning coffee. Vitamins, supplements, complex things called biologics, technically, they're all drugs.
Now, the entire field that's dedicated to understanding this whole world, from creating these substances to figuring out exactly how they affect us, that is pharmacology.
The name itself is kind of a dead giveaway. It comes from two Greek words, pharmakon, which means drug, and logia, which means study. So put them together, and pharmacology is, quite literally, the study of drugs. Simple as that.
And why should you care? Well, because this field is the engine that drives modern medicine. It's how we invent brand new treatments, how we make sure they're safe, and how we figure out the absolute best way to use them to help people get better.
And all this work leads to a really fascinating, kind of impossible goal. You could say that every pharmacologist is chasing something called the ideal drug. So, just for a second, imagine you could design the perfect medicine from scratch. What would it do? What features would be on your ultimate wish list?
Well, at the very top of that list, you'd find these three non-negotiables. First, it has to be effective. I mean, it has to actually work, right? Second, it's got to be safe, causing as little harm as possible. And third, it needs to be selective. That means it's like a sniper, taking out the problem, like a cancer cell, without hurting all the healthy cells around it. But of course, back in the real world, no drug is perfect. It really is just a wish list. We hope for drugs that are reversible, that work predictably every time, that have zero side effects, that are cheap and easy to take. But hitting all of those marks with one drug, it's an incredibly tough balancing act. The truly perfect drug just doesn't exist.
So if perfection is off the table, what's the actual goal? It really boils down to this: getting the absolute maximum benefit for the patient with the absolute minimum amount of harm. That's the name of the game.
And to achieve that goal, you have to understand two fundamental ideas. Think of them as the two pillars of pharmacology: pharmacokinetics and pharmacodynamics. A simple way to remember it is one is about the drug's journey through the body, and the other is about its final mission in the body. So let's start with that journey. Pharmacokinetics is all about what our body does to a drug from the second we take it until it's gone. This journey is broken down into 4 key stages, which you'll often hear called ADME. First, there's absorption, getting the drug into our system. Then distribution, as it travels around the body. Next is metabolism, where the body breaks it down, usually in the liver. And finally, excretion, which is just how our body gets rid of what's left.
Okay, so once the drug has completed its journey and arrived at its target, it's time for the mission to begin. And this is our second pillar, pharmacodynamics. So if pharmacokinetics was the journey, pharmacodynamics is the destination. This is where the magic happens. It's all about what the drug actually does to the body. This is the drug binding to a receptor, blocking an enzyme, or fixing a chemical imbalance, whatever it needs to do to create that therapeutic effect we're looking for.
So just remember these two core concepts: pharmacokinetics, what the body does to the drug, and pharmacodynamics, what the drug does to the body. If you can get those two straight, you've honestly grasped the foundation of how pretty much all medicines work.
And this all leaves us with a pretty mind-blowing question for the future.
We know that a single ideal drug for everyone doesn't exist, but as we get better and better at reading our own unique genetic code, could we one day design the perfect, personalized drug for every single individual? That is the incredible goal that's driving the future of pharmacology. Thanks for joining us.